Welcome everybody to this resident-led town hall, A Right to Clean Air. We'll be starting in just a moment. Welcome everybody, glad to have you here. We'll be starting in just a moment. Keep in mind that we are recording and we are live streaming, live to Facebook. It's streaming at the North Braddock Residents for Our Future Facebook page, and also at the Breathe Project Facebook page and the Blue Lens Facebook page. If you're able to share the live stream on Facebook, that'll help get the word out. We'll be starting in just a moment. All right, thanks everybody for joining. I'm going to start us right off with a video, and then after that, Howard will open this town hall meeting. Thanks everybody for joining. And if you have any questions, feel free to bring them up in the chat, either publicly or privately to me, Mark Dixon. And now for the video.
The current levels of pollution that we're all breathing are unacceptable, and we can't tolerate it more because it's killing us.
We deserve clean air now. We deserved it yesterday. Our children deserve it.
This is a paper towel off a screen from my bedroom window that I clean every week. I clean this crap off my window.
The Clairton Coke Works is one of the most toxic industrial facilities in Allegheny County.
I never missed a day running in New York City because the air smelled or because I felt like I had a breathing issue. In Pittsburgh, I've missed too many days to count.
The most livable city in America isn't livable if the air isn't breathable.
So welcome to the fire. Because we've been putting up with U.S. Steel's poor environmental record for 150 years now. My mother, who passed away last year from COPD, she never smoked a cigarette in her life, but we live right here next to U.S. Steel.
Everybody in my family's been riddled with cancer. My brother just died of cancer.
Approximately 130,000 people live within a 5-mile radius of the Coke Works. People in this area have air that's worse than 91% of the entire country.
The children are being sickened. They're developing asthma at a very early age.
I am also the mother of 2, and I fear for my children's and my family's health.
I have a 5-month-old daughter who I'm scared to raise here in the city.
A year and a half ago, I was diagnosed with chronic bronchitis that is likely due to the poor air quality in Pittsburgh.
And I can't understand how there's not enough compassion to put a stop to this.
So welcome to the fire.
If you understand that your child's asthma is approximately the result of Norfolk Southern or is going to be exacerbated by it, then you're going to come to a meeting and raise your voice.
Where petrochemical development occurs, people tend to suffer.
This area has so much more to offer than becoming a cancer alley.
We've got our work cut out for us.
So welcome to
Health Department is in charge of enforcing our Clean Air Act and protecting our health. Do you think they're doing a good job? No!
This anger, anxiety, and frustration are the results of residents enduring decades' worth of air pollution and violations.
It's on us to be bold, and it's also on us to listen to the needs of the people who are here. They are suffering.
Welcome to the fire. 'Cause the bigger they are, the harder they fall. You build your fortress and I'll climb your walls. You got your armor, but I see your flaws. So welcome to the fire.
We are starting to elect politicians who pay attention and fight hard for clean air. And if you do not fight hard for clean air, we're done with you.
We have to hold accountable those who are harming our communities.
So welcome to the fire.
For decades, we have not been able to breathe.
There is a legal and moral obligation to make the county act.
What do we want?
Clean air! Because cancer should not be the cost of breathing in America's most livable city.
Enough is enough.
Super. There we go. And now we can move to an introduction from Howard Rieger. Howard, please go ahead. I will spotlight you. And
Hi, and welcome. I'm Howard Rieger. I'm the convener of East End Neighbors, a group of individuals who want to fight air pollution. I'm chairing this residents' town hall, the third in an ongoing series of town halls that are aimed at making a difference in our community, transforming us from one of the unhealthiest places to live in America to one with an improved quality of life for all of us. Today, you'll hear from three experts who have scientific and professional expertise in tracking air pollution and dealing with its consequences. What makes them unique is not just their scientific grounding and their public health background, but their total independence. They aren't beholden to anyone. They tell it like it is, even when it's uncomfortable to hear what they're saying. We'll also hear from two residents of environmental justice communities who bear the burden of this problem, voices that are too often shunted aside by the establishment. There was a time when elected officials in this region came together with corporate leaders and fought for cleaner air. They solved the smoke problem in Pittsburgh, but that left us with small particle pollution, less visible, but much more deadly, and they've done nothing about it. Our county executive and the corporate leadership of the Allegheny Conference have been on the sidelines, silent. So have the leaders of our huge healthcare enterprise. They know that Allegheny County is in the 2% worst places in America for cancers caused by air pollution. They know that our youth asthma rate is 2.5 to 3 times the national average. They see the victims of pollution every day in their facilities. So why have they joined in this strategic silence rather than stepping up to the plate to push for policies that might lead to a healthier future? Exactly who does profit from silence? Even a greatly diminished U.S. Steel, well known for not meeting most of its commitments to our community, felt the need to announce a plan to go carbon neutral in the future. If U.S. Steel can make such a grandiose promise, even though most of us would assume they're never going to fulfill it, how can our healthcare institutions, our county executive, and the Allegheny Conference maintain their silence? At the end of this town hall, we'll distribute a fact sheet that will summarize some of the things that our presenters have put on the table today. We also plan a follow-up to this town hall. You'll find it in the chat, and that's going to give you that information that they talked about. We also plan a follow-up to this town hall where we're going to be communicating directly with healthcare officials. So stay tuned for that. And finally, we hope to share plans for a fourth town hall that's going to focus on environmental justice communities and building further on that voice of the people who have the lived experience of unfortunately residing right near the worst sources of pollution in our community. Now sit back, join me in learning from our presenters, and stay on for the chat at the end that's going to allow for an open mic, and you can become part of the dialogue. Thank you, and thank you again for participating.
Super, thank you so much, Howard. Can everybody hear me okay?
Yes.
It's like, okay. Great, I'd like to introduce Dr. Deborah Gentile, MD, Medical Director, Community Partners in Asthma Care. Dr. Gentile's recent research efforts have focused on evaluating asthma outcomes and triggers in disparate children from the Pittsburgh region. Dr. Gentile completed medical school, pediatric residency, and allergy immunology fellowship at the University of Pittsburgh. She's authored more than 60 publications and is the recipient of numerous awards for her research efforts. I'm delighted to welcome Dr. Deborah Gentile, and I'll be presenting your slides, so I'll be sharing those here as I spotlight you.
Sure. Thank you very much, Mark, for the introduction. And thank you, Howard, as well, for putting this whole program together. I'm going to spend a few minutes talking to you about the adverse health effects of outdoor air pollution. And basically, I'm going to start by defining what outdoor air pollution is, talking to you about what the health effects are. I'm obviously going to focus on my recent asthma findings, both with the children as well as the adults who were exposed to the smoke at the Clairton Coke Works fire. And I'm going to end up talking a bit about how our current thresholds set by the Environmental Protection Agency to protect us really aren't adequate and are likely to be changed in the next few years. So go ahead and turn to the next slide, please, Mark. Particulate matter is what I'm going to focus on. Is a quantifiable component of air pollution, and unfortunately affects more people than any other air pollutant. It's a complex mixture of solid and liquid particles, and it can contain organic and inorganic substances that are suspended in the air. Some of the components are sulfates, nitrates, ammonia, sodium chloride, black carbon, even dust and water. There's two main categories. Primary is what comes directly from the sources, such as smokestacks, fires, construction sites, or unpaved roads. And then secondary particles are formed basically in the atmosphere from reactions between these chemicals that are emitted. And then they can go ahead and cause problems as well. An example of that is sulfur dioxide. Sulfur dioxide is a gas that's released from some of these point sources of pollution near us. And when a patient inhales them, it interfaces with the lining of the breathing tubes, and it actually it causes problems. So I'll go ahead on to the next slide, please. How does particulate matter cause adverse health effects? We're looking at a depiction of this. A small particle material that's less than 2.5 microns, that's actually shown there by those red beads. They're very, very small. You can see their size in relation to the diameter of a hair or in relation to the diameter of sand grains. You really don't see these. They appear invisible to our eye. You can breathe these in and they can get deep into your airways. There's some larger particles that will be filtered out by the nose and hit the back of your airway, the back of your throat when you're breathing them in. But these very small particles can actually be inhaled deep into your lungs. And then from there, they can cross over to your bloodstream and go to all different types of organs. So they can go to your heart and cause heart problems. They can also go to the brain and cause dementia. And that's why we're so concerned about these. It's not just lung problems, but it can be whole body problems as well. Next slide, please. The EPA actually has done a lot of work over the years, and they update recommendations every several years in a scientific assessment that they call their integrative scientific assessment. This was recently updated in 2019 for particulate matter. And basically, they look at all the evidence that's out there. They look at the environmental studies, they look at laboratory studies, animal studies, as well as all the epidemiologic studies. And what they do is they determine if there's enough data to say that air pollution is causing disease or not causing it. And they actually have very strong evidence that PM 2.5 causes disease. And there's also evidence that it's very likely to cause disease. And so this is indisputable. This is years and years and decades of research that's compiled and updated frequently. We know that PM 2.5 does cause problems, short-term exposure in a period of hours to days, as well as long-term exposure in months to years, is associated with increased mortality or death. We know that's a causal relationship. And we also know that short-term and long-term exposure is also causal for heart problems. And those are things like heart attacks, arrhythmias, congestive heart failure. We also know that the EPA defines particulate matter as likely to be causal to other health effects. We know it's likely to be causal for short-term and long-term exposure and respiratory effects. These are things like asthma and COPD and increased susceptibility to respiratory infection. There's also links between long-term PM 2.5 exposure and cancer, and also long-term exposure and nervous system effects, specifically dementia. We also know that sulfur dioxide, which is a component of PM 2.5, is causally related to asthma. We know that short-term exposure can trigger asthma. Next slide, please. Just a few asthma facts. It's a very common disease that affects about 25 million Americans. It results in about 10 million doctor visits annually. There's almost 1.5 million emergency room visits every year for it, and 180,000 hospitalizations. And unfortunately, in this day and age, with excellent specialists as well as excellent medication to control this disease, we still see over 3,000 deaths in the US each year. It costs us tremendous amount of money, both in direct and indirect cost. Indirect cost would be missed school and work, billions and billions of dollars. Children are very vulnerable to asthma. They're one of the vulnerable populations, and they're also very vulnerable to air pollution. They basically breathe at a faster rate than adults, so they're bringing in more air that could be polluted. They also, if you took their lung surface area and expanded it out, their lung surface area is much larger than that of an adult, relatively speaking. So that also causes them to have higher exposures. And then the other thing is that they're often active outdoors more and playing, and that means they're breathing even harder and faster and bringing in more of this pollution. So children are a very vulnerable population for asthma in general, and air pollution effects on asthma in particular. Asthma is unfortunately the most common chronic disease of childhood, and it very much impacts these children's lives. Families don't sleep at night because their children are having asthma attacks, kids are missing school, adults are missing work. There's urgent visits to the doctor's office. There's also emergency room visits and sometimes hospitalizations. This disease impacts how they learn because they're missing school. They may not be sleeping well, so they can't pay attention. A lot of these kids are sitting on the bench because exercise can trigger their asthma if it's not controlled. And so they can be in less physical, they can have less physical shape than we want because they're not as active. And in the long run, that can set them up for other chronic diseases like heart problems, obesity, and even diabetes. And a lot of times these kids aren't participating in sports and running around with the other children. And they're embarrassed by their disease, so they feel socially isolated and they're just not socializing. It can be very frightening to have an asthma attack, and we'll describe that in a minute. The other important thing is asthma, just like air pollution, is an issue with disparities. African Americans are 5 times more likely to go to the emergency room for asthma, and they're actually 3 times more likely to die of asthma. So it's very much a disease of disparities. Next slide, please. This is basically what happens when you're exposed to air pollution and you have asthma. The left side of the graph there is showing you what a breathing tube in your lung looks like if you don't have asthma. We all have some smooth muscle that surrounds our breathing tube, and there's a lining in the breathing tube, and you can see that this tube is wide open. What happens with a patient who has asthma is that whatever's triggering them, including air pollution or allergens or even a respiratory infection, it causes a variety of problems. One of the first things that happens is it causes inflammation or swelling. So that lining in the tube gets very thick. So that decreases how open the tube is and makes it hard to breathe in and out. That inflammation also causes mucus to be produced, and that also can block the airway. And then finally, a lot of the chemicals that are produced can actually cause tightening of the breathing muscle. And what happens when that breathing muscle tightens, it also shuts that tube down. So you have these 3 things happening to cause an asthma attack, and it significantly diminishes how open that breathing tube is. Patients having an asthma attack often describe it as a feeling of trying to breathe through a straw. It's a very frightening feeling. You can't get the air out, and then you can't get it in as well. And unfortunately, the emotional response to having an attack, the fear and the upset actually can worsen it as well. It's very frightening to watch someone have an asthma attack. They're basically gasping for breath. It's just very frightening. And I know we have someone that's going to describe that in a few minutes. Air pollution is one of the triggers of asthma. It's not the only thing that causes asthma, but it certainly is an important thing. We know that in the short-term exposure to particulate matter, it's been proven that it decreases lung function. That's how well your lungs are working. It increases symptoms of asthma and increased rescue medicine use. We know that patients have increased emergency room visits when they're exposed to short-term PM 2.5, and they also have increased rates of hospitalization. Long-term PM 2.5 exposure is also important in asthma. We know it again causes long-term decreases in lung function. And again, these children are very vulnerable. Their lungs are developing during childhood, and if they're exposed, we actually know that air pollution exposure can interfere with how their lungs are growing and developing. So their lungs may not achieve what their total adult size should be. And they also have an increased risk of asthma attacks from this long-term exposure. Next slide, please. I'm going to spend just a few minutes summarizing my work that was published in November. We had done a very large study really looking to see what the impact of air pollution was on childhood asthma and vulnerable children within our county. We enrolled 1,200 school children that resided near point sources of pollution. These included the Clairton Coke Works, the Braddock Steel Mill, the Cheswick facility, and it also included the Gateway School District, which is near the Turnpike Junction out here in the east. And what we found was in these 1,200 children, they were disparate. About 50% of them were African-American, and over 60% of them were on public health insurance. So much higher rates that are telling you that they're both African-American or minority and poor. We found that 70% of the children that participated in the study had annual exposure to PM 2.5 above the World Health Organization threshold. The World Health Organization threshold is a bit more stringent than the current EPA threshold. It's 10 micrograms per meter cubed. 70% of these kids had annual exposure of particulate matter above that level. 40%, if you look at the less stringent EPA threshold, 40% had exposure above that. And we also had data showing that the closer you live to the air pollution site, the higher your pollution levels were. We found that 22.4% of the children in this study had asthma. And that was using a validated survey that has a high level of significance in picking up asthma. This is 2 to 3 times what we expect across the state and what we expect across the county, as well as across the US. These numbers are high and they're alarming. Also, the highest rates were in African-American children. Overall, if you were African-American, your likelihood of having asthma was 26%. Again, very high numbers. And then we also know that there was nearly a 60% increase in having an asthma diagnosis if the children were exposed to high levels of pollution, particulate matter that's above the World Health Organization threshold. We also looked at asthma control. Again, you can take medicines and avoid triggers to try to control your asthma. And we wanted to see how many of these children had controlled disease and uncontrolled disease. Of the children with physician-diagnosed asthma, almost 60% had uncontrolled disease. And that means they were having symptoms at night and then during the day and not participating in activities and needing to go see the doctor. And that's double what we expected. Across the state, the uncontrolled rate is reported at 27%. And again, when we looked at it, we found that it was tracking in the females. The females were 5 times more likely to have uncontrolled asthma if they were exposed to the PM 2.5 levels above that World Health Organization threshold of 10. And again, that level was more stringent than our current EPA, which is set at 12. These results show that there is a significant impact of outdoor air pollution in our region on these vulnerable children. And I really look at this as meaning that we need to focus on what we call primary prevention. If we can actually prevent these children from being exposed to air pollution, we're going to decrease their likelihood of having asthma. And if they do have asthma, we're going to decrease their likelihood of having attacks. So I think that's what we really, need to focus on moving forward. Next slide, please. This is actually going to be a slide that's looking at my work that focused on emergency room visits as well as sick visits to the doctor's offices and residents residing in the Clairton zip code after the Clairton Coke Works fire. If you recall correctly, that fire happened on Christmas Eve, 2018, and damaged the pollution control equipment for the desulfurization process. And so basically the plant kept running at full capacity without their pollution control measures in place. And there were multiple exceedances of pollutants measured at the monitors. And we also know that there were 24 to 35 times increased amounts of pollution coming out of the facility during those months. What we did was we took a time period of 2 months right after that fire, when the Coke Works control equipment, emission control equipment was offline, and compared it to the prior year. And we looked to see how many residents from Clairton zip code were going to the emergency room for asthma attacks or going to their primary care physician for asthma attacks. We actually found a near doubling of that. In the time frame before the fire, which again is the same period year before, we actually found that there were 54 outpatient visits to doctors for asthma attacks. And then in that period after the fire, it nearly doubled to 98. The same thing for the emergency room visits. There were 19 in that period for Clairton residents before the fire. And after the fire, it nearly doubled to 35. So this really shows that this did have a significant impact. We did some work to try to see if this was related to weather inversions or wind direction and even flu activity. And we found that those weren't affecting it. In fact, the flu season was worse the prior year than it was the year after the fire. And also we saw no increase in incidence, duration, or severity of inversions in that period after the fire. So these results are showing a near doubling of asthma attacks in patients who reside in Clairton during that fire period. And my results are very consistent with the study that my colleagues at Pitt published. Their study was a little bit different. They actually looked at patients that were enrolled in an asthma registry, and they found that the patients who lived nearer to the facility in Clairton after that fire had increased asthma symptoms and increased rescue medication use for asthma attacks. And surprisingly, 50% of the patients in their study didn't even know the fire had happened, and there were pollution exceedances. So these results are independent. I wasn't involved in collecting theirs, and they weren't involved in collecting my study results, but they're showing very much the same thing. Increased asthma symptoms and attacks right after that fire. And I really think that we learned some lessons from this fire, and we need to really push for policy initiatives moving forward. The fact that 50% of these people were unaware of the fire and the exceedances is very alarming. We need some type of alert system to warn residents, and we also need some regulation to decrease pollution during events like this. And I also think we need some type of organized response to assess what's going on in the community. We shouldn't have to wait for 2 years for our scientific studies to come out and be published and go through that whole process to say that health effects occurred. We need to be able to get down on the ground quickly and find out what's going on. Next slide. I'm nearing the end here, but I wanted to talk about some of the other impacts of outdoor air pollution. There's a variety of vulnerable populations. We talked about children, but pregnant women are vulnerable. We actually have data from other studies telling us that women exposed to air pollution during their pregnancy, their child's more likely to have asthma because of that exposure. Elderly are vulnerable populations, and anyone with underlying health conditions, particularly that affect the lung or the heart, are at risk for air pollution effects. And you're going to hear more about this later on, but there are a lot of social disparities. The minorities, African Americans, anyone of color, and then poorer people are more at risk. And that's typically because they live closer to these sites of pollution. There's widespread health impacts in Allegheny County. I focused on my area of expertise, which is asthma, but there have been numerous studies published in recent years showing increased mortality, heart impacts, respiratory impacts, and even birth outcome impacts in patients exposed to air pollution within our county. The other thing I want to point out is air pollution can interact with other triggers. We know respiratory viruses can trigger asthma, and we also know allergens can. Pollution can work with these things to make exacerbations worse. So if you're exposed to 2 triggers, air pollution plus allergies, you could have worse outcomes than alone. The other thing is that we know that there's synergism with air pollution and COVID-19. It's been published that there's an 8% increase in death from COVID-19 for each 1 microgram per meter cubed increase in long-term exposure to particulate matter. So that's established. Next slide, please. I also want to end up by saying that the current standards that we have do not protect public health. There are newer studies with larger populations that are 10 times higher numbers of people being studied to show health effects below the current EPA standards. Just like the World Health Organization has a lower standard than we do, Canada does as well. We've actually can estimate that there's 13,500 to 52,100 annual deaths from long-term PM 2.5 exposure each year. And that's on par, if not more, than we see with flu infection. More people are dying of air pollution each year than they are of the flu. And then the short-term exposure can also lead to increased deaths. We think there's 1,200 to 3,800 annual deaths from just short-term exposure each year. The EPA panel that was composed and put together to do the most recent update to the scientific assessment that was published in 2019 actually recommended that the long-term PM 2.5 standard to be decreased from 12 down to a range of 8 to 10 micrograms per meter cubed annually. And they also recommended that the short-term exposure limit be decreased from 35 down to 25 to 30 over a 24-hour period. So those are significant decreases. The EPA administrator at the time rejected these recommendations, and now with the new administration in place, they're being revisited. So the expectation is that they're going to even update the data more because several years have passed, and then within the next few years, there's an expectation that these levels are going to decrease to within a recommended range. And there's even a small decrease in exposure can save lives. We expect to see a 21 to 70% reduction in relative risk of annual deaths with long-term PM2.5 exposure if our current annual standards decrease from 12 down to 9 micrograms annually. So that's significant. Next slide, please. And this is my final slide, and I just want to summarize that we do know air pollution adversely impacts health of Allegheny County residents. Unfortunately, many of these residents reside in environmental justice areas, and you're going to hear a bit about that more from one of the other speakers. But they tend to be people of color, poor people who are living right next to these facilities and can't move away. I also showed you some data that the current PM2.5 standards are inadequate to protect health. You saw in my data that I collected in the school children, we used a World Health limit of 10, and we were still seeing a significant relationship between being exposed to those lower levels and the asthma exacerbations. And, certainly I just showed you some of the mortality data and the fact that the panel that had advised the previous administration did recommend that the limit be decreased. I also think that some of this work points to the need for action items, and I'm not going to go through these in detail, but we are starting to hear that there's work on episodic regulations, that if we're predicting high pollution days, that the industries would have to decrease their emissions. Again, we need a better alert system so that everyone is notified. It's astounding that 50% of the people in my PIT colleagues study weren't even aware of this fire or the exceedances. And we also need more of an organized response so we can determine what's going on. Again, it took my colleagues at Pitt as well as myself 2 years to really get this data published showing the increased asthma impacts on the Clairton residents after the fire, and we shouldn't have to wait that long. We need a system where we can mobilize a team to go down and start assessing what the health impacts are and getting people the treatment they need. And one of the ways to help with that would be forming a health registry where we're following vulnerable patients over time. So I thank everyone for their attention. And with that, I'm going to go ahead and end and turn this back to Mark.
Thank you, Dr. Gentile. I really appreciate your words there and your message. Invaluable. We've been receiving some great questions in the chat. I just want to encourage everybody to keep dropping in your questions into the chat. We'll be addressing them towards the end of the program, and we'll follow up with you if we're able to get an answer if we don't answer them during the actual event. So coming up next, we have Amanda Jones, who is a 2020 graduate of Obama Classical Academy, a Pittsburgh Public High School, and a senior college student who's a resident of Larimer. Jones will speak about the impact that asthma has had upon her and her entire family, a youth leader and board member at NextGen PGH, whose Civic Stages program trained her and other students at Obama High School in leadership skills to advance advocacy and activism. Jones is committed to making our community a better place to live. I had the privilege of meeting with Amanda in person to film this segment, and my hope is that this in-person pre-recording really helps to do justice to her message. I was really moved by what she had to say. So I will now share my screen and play that video. And coming up after that, we'll have Albert Presto.
Hi, my name is Amanda Jones, and this is my testimony on air quality in Pittsburgh. Sometimes, when we think of asthma and the effects it has on people's lives, I think it's the more serious things that come to our minds. And I have stories about those situations, the big events that were shocking, that shook my world. But what I don't hear enough about are the daily occurrences, the moments I could see coming that would scare me the most. When the weather was bad and the air would be heavy and compressing on our lungs. How I knew when I walked outside and took in the world around me, that it would be a day my mom wouldn't get out of bed. When the air quality was hurting me, I would instinctively want to call my grandma because I knew whatever I was feeling was a fracture of the pain that she had herself. It was almost foreboding, and as a kid, it made me angry. It felt like the environment was their enemy and that their bodies weren't their friends. And being mad at the world made me a little bitter as a kid could get. I would throw plastic in the trash and waste paper because that was my way of hurting the world back. But then I got a little older, and I found out why the air in the city was as bad as it was. That the city had pumped poison into the air for decades and had done little to nothing to fix the problems that they created. That it was the fault of men that caused my grandma to cough in a way that physically hurt me. That would make us scared to go outside without albuterol. The panic that we'd feel without it. Human negligence that keeps my godson in the house on sunny days when he should be outside. Those are the moments that I think about and have stayed with me, moments that haunt me. Memories of my dad's lungs seizing in the cold. My sister panicking at her basketball games because while the other girls were battling with themselves, she was fighting with her own body. The stress my mom has before and after an asthma attack. Being able to feel all the air and noticing around her, but not being able to take any in herself. The small things, the regular days, the regular disturbances that I will never forget.
And now I have Albert Presto on deck to introduce. And let's see. So Albert Presto, Ph.D., is an associate research professor in the Department of Mechanical Engineering at CMU and a member of CMU's Center for Atmospheric Particle Studies. Presto's research focuses on pollutant emissions from gas and oil wells that emit methane, a powerful greenhouse gas. Cars, trucks, and trains operating on gasoline and diesel fuels emit carbon monoxide, nitrogen oxides, and particulate matter, making mobile sources of pollution, including an expanding freight rail network, a major concern for our region. I'm delighted to welcome Albert Presto. Dr. Albert Presto, please.
All right, thank you. Okay, everyone can hear me and can see my screen?
Yes, we can see your screen. We can't see you, but that's okay if you want to stay hidden. It'd be great to see your face.
Oh, I have my video on.
Oh, okay. We got to remove my spotlight. Okay, hold on. Thank you.
Okay.
And there we go. Go ahead.
All right. So I'm going to talk briefly about so a lot of work that we do in my group has to do with sort of hyper-local air quality. And so we have a lot of cool data on that. And I'm going to share some of that with you and talk a little bit about how we do it. So when I say hyper-local, what I mean is something like this, right? So we focus a lot on sort of understanding air pollution at sort of like a block by block or neighborhood by neighborhood level. And this is one example. And so the QR code here, you can actually go, if you scan that QR code, it will take you to the Breathe Project website. You can actually go to this map and put in your own address and see if you're in a blue area or a red area. And so this is for the coloring here. Blue is low concentration and red is high concentration. And this is for one component of particulate matter. So Dr. Gentile was talking about particulate matter. One of the components of it is this stuff called black carbon. And it's soot, right? So important sources of it are traffic, right? So you can see the black stuff coming out of the smokestack of that truck. And so that's what we're mapping here. And correspondingly, you can see the major highways, right? So I'm pointing to, this is 79 and the Turnpike. And then when you get downtown, there's like a big snarl of busy roads and you can sort of see them in the map as well. And then there are other sources of black carbon. Sort of locally, an important one is industrial emissions. So down here and along the Monongahela River, these sort of more blobbish looking things are basically from the industrial emissions, right? And so you can sort of look around and see that concentrations of this change pretty rapidly. It depends on exactly where you are, and so it can make a big difference whether you live close to a source or farther from a source. So just to sort of the few points I want to make in about 10-ish minutes are that we have this sort of unique wealth of this sort of hyperlocal air quality data. And we can use this data to think about what the sources are and what their emissions are and what the impacts of them are, what human exposures are. Because when I have a map like I showed on the last slide, and if I know where people live, then I can estimate who's exposed to what. And we can look at environmental injustice. So the way we do this, the way we actually sort of collect the data that we need is two ways. So one is we run a network of low-cost sensors. They're called ramps. So if I happen to say ramp, that's our low-cost sensor suite. And this is a picture of the network as it existed a few years ago. Each dot is a sensor. We move them around depending on community needs. So if anyone's ever interested in sort of hosting a sensor, we really rely on we put some of them at schools, but a lot of them are at people's homes. So feel free to contact me. You can email me. If you Google my name, you should get me. And we can talk about possibilities of placing a sensor. But so we have these sensors, and then we also do mobile sampling. And so obviously the sensors are stationary and they actually operate all the time. So we get data 24 hours a day. The mobile sampling, we can learn a lot more about sort of, the real detail of the, of particulate matter composition, but we can only be in one place at one time. I only have one of these vans. And then sometimes it takes a big effort just to get that one running. So I want to give you a sense of, if I already showed you sort of one map of just the county, but if we zoom out a little bit further, for any pollutant, there's a pretty similar shape. And it's basically there's a hump where people live, and then there are spikes on top of that hump. And I'll sort of try and describe what I mean there. So I've zoomed out a map a little bit, and I'm not telling you what pollutant it is, because again, the picture is basically the same for almost any air pollutant. Yellow is going to be lower concentration, and dark red, almost to black, is going to be high concentration, right? And so I'm showing the whole metropolitan area. That's the outer boundary here. I'm showing the county, and I'm showing the city. And then I have this dashed line running through there from points 1 to 7. And if we just sort of extract the concentrations along that line, we get this little picture here, right? And so we can see, so points 1 and 7 are the edges of the MSA. Points 2 and 6 are the edges of the county. 3 and 5 are edges of the city, and then 4 is sort of downtown, right? And so we can see this hump, right? That from the, if you go across the whole MSA, there's sort of this hump. It's highest in the middle in downtown, but then there are other spikes as well. So right before 0.5, there's this sort of local spike that would be from a local source, right? And it doesn't matter necessarily how I orient that line. If I redrew this dashed line, so it ran sort of northwest to southeast or southwest to northeast, I would get the same basic picture. I'd get the hump, and I'd get maybe spikes in different places. But this is the picture for any pollutant that's sort of associated with basically how many people are around, right? So people, drive cars and they cook and they do other things that emit air pollutants. And so anything that's sort of correlated with just the population, you get this same sort of picture. That's a zoomed out view. We can also look at the sensor network, and that gets us sort of details about specific locations. And so I'm going to build up this plot here. So the first thing that happens is when you have 50 sensors, internally, you end up with lots of names for them that don't mean anything to anyone else. So I have a bunch of sensor names there, but I'm going to cover them. And we're just going to bin things right now to talk about sort of 3 areas. So one area is going to basically be sensors that are either in downtown or in high traffic areas. A bunch of them are going to be, I have it labeled urban background, but it's just sort of residential. And some of them are urban residential, some are suburban residential. And then we have a chunk on the right that are going to be in industrial areas. And so what I'm going to do is I'm going to fill in the percent of the time that particulate matter concentrations at each of these locations is in certain bounds. And so we'll add that. And so green essentially means good, right? This is sort of a traffic light analogy. Green means good, yellow means less good, and then orange and red are progressively worse, right? And so I'll point out here, I don't like this axis on the right or on the left doesn't go all the way to 0. So 40, I've cut it off at 40% so that we can sort of look at the differences, right? But so, and when we see for a lot of these, we see some variety among these sites, right? But if you look at them, you know, sort of, if you just sort of take the broad view, except for the second one here from the left, which we'll talk about in a second, there's a lot of similarity, right? The green goes up to, you know, 60 or 70 or maybe 80% for all of them. If you take green plus yellow, it goes up to sort of 90 to 95%. And then there's varying amounts of orange and red depending on where you are. And that's actually where sort of the action is in the orange and red. So this first one here, this one that's mostly yellow, was actually downtown. This is the First Lutheran Church downtown. Its air intake is right across from the vent from this restaurant. I don't remember the name of the restaurant. But you can actually see sort of the plume of emissions from that restaurant. And the folks who worked in here were getting basically hammered by this and really had high pollutant concentrations, in part because this is a pizza oven, but I think at one point also it was a wood-fired pizza oven and they were venting the wood smoke out of here as well. And so that's why we have really high concentrations there. This is a good sort of lesson, right? So when you have a lot of sensors, you're going to get these sort of idiosyncratic results that, you know, maybe this site doesn't mean a whole lot for, you know, lots of people who are downtown, but a lot of people use this alley as a cut through. There are people working in this building. There are people who are exposed. We can also look at the industrial sites, and the difference between those and the rest of them is that over the long term, there is more PM at those areas. There's higher concentrations. And it's really the driver for it is that they have more frequently are in the orange and the red. And it actually depends on where you are, if you're downwind of the industrial areas versus, or of the specific emitting industries versus upwind. So the ones that have sort of more red and orange are downwind, and the ones that have less are upwind, right? Because the wind carries the pollution with it, right? But that's, you know, so folks who are living in these sort of two rightmost have higher long-term concentrations, but then they also get these more frequent events of higher concentration for shorter terms as well. Just a couple other examples that I want to highlight of things we can do with this sort of network. One is one nice advantage of having a network that essentially runs itself. Well, all of the instruments run, you know, on their own. I have a really awesome guy who manages it all and who really makes it work. But because the sensors sort of operate or on their own, when we had all the COVID-19 closures, we could actually look at the difference between sort of, you know, the base case and when everything shut down last March or March 20 of 2020. And it was sort of what we would expect, right? So lots less people, you know, everyone went into lockdown, a lot less people were on the road, so we could see less traffic pollution. But most of the industrial sources around here were deemed essential industries by the governor. And so the industrial emissions essentially stayed the same during all of the COVID closures. So that's one example. Another example has to do with the event we had last week. So last week, we had this wildfire smoke event. So it was really polluted in the middle of last week. And that was because there are these big wildfires out west and the smoke from them was actually reaching us. And that smoke has been wafting around. It might actually come back. It hit us and then it was hitting New York City. Yesterday I saw it was really hitting Connecticut badly, right? So sort of the wrong shift in the winds could bring it back here. And again, there's a QR code here if you're able to scan that. What we do is for this sensor network is we put up reports and we put up sort of monthly reports that cover the whole network. But then we also put up some special reports, and I'm actually showing you one image from a special report that I posted on Monday night that has to do with this smoke event. So again, I encourage you to check that. You know, you can check out those reports by using the QR code there. But basically, what happened during the middle of last week was that. So I'm showing each bar is a daily average for PM 2.5 concentration. And then on the left is the concentration as it was measured. The right is the ratio to sort of typical. So typical around here is 10 microgram per cubic meter. which is right at the World Health Organization standard. So we can see on July 17 and July 23, which are sort of 2 days without the impact from the smoke, we were right at sort of typical concentrations. But on the 20th, which was the worst day, it was 5.5 times worse than normal, right? And that was the day that it was, 19th, 20th, and 21st were all pretty hazy, but the 20th was the worst of those days. And again, this was from that wildfire smoke event hitting us. And so then the last thing I want to briefly touch on is that we can use all of this data to think about environmental injustice, right? So when we have maps like this, right, we have air pollution mapped out spatially. We also know where people live from the census. And the census also gives us things about them, not just where they live, right? We know their sort of age distribution, we know their incomes, we know their race, et cetera. And so one thing we can do with that is we can look at air pollution as a function of these different socioeconomic factors. And so this is one example of something I did with some folks at Pitt and the health department. So in the county, there are about 400 census tracts, and the state, based on the sort of income and racial makeup of each census tract, some are deemed what are called environmental justice census tracts, and they're shown as the red bars, and some are not, right? And they're the black bars, right? And so it doesn't, and what we've done here is we've just them. For one particular pollutant, the ones on the left have the lowest concentration and the ones on the right have the highest concentration, right? And you don't need any fancy statistics to see what's going on here, right? The ones on the left are the non-environmental justice ones, almost exclusively up through the first 50 or so. And the ones on the right are more likely to be red, right? They're more likely to be the environmental justice tracts. And so we can quantify this for a bunch of different pollutants, sort of at the city scale or at the county scale. And really it's and we can also do this at the national scale. And there's a consistent story of environmental injustice that's mostly coupled with race, maybe a little bit with income, but mostly with race. So just to wrap up, we have all of this sort of unique wealth of this hyperlocal air quality data. We try and use it at CMU to think about a bunch of things. We do also, I should point out, we try and make all of this publicly available. So I've shared those few links with you. If I was going too fast and you missed them, you can email me or you can put in the chat and I'll try and drop some of the links into the chat later as well. And I think, yeah, that is my last slide. So thanks for your attention, and I'll look forward to questions later, and I will stop sharing so Mark can show the next thing.
Thank you, Dr. Presto. Appreciate it very much. Always informative, and your monitoring and your efforts to trace the air all around Pittsburgh, especially with your fancy truck, is always lends to great stories and great information. So thank you for that. I want to let everybody on the call know that we are, let's see, there we go. We have two more presenters. And I want to, first will come John Graham, Dr. John Graham, and then we have Johnny Perryman, who's a resident of Clairton. And I just want to encourage you all to stick around for Johnny Perryman. He is an incredible, incredible person. And I spent hours and hours with him to interview him and pulled some of the most relevant little snippets from his personal story to include in a brief video testimonial from him. So I want you to just make sure that you stick around for that very, very special closing presentation that we have that that's coming up after Dr. John Graham. So Ph.D, he's a senior scientist at the Clean Air Task Force. And Graham is a technical specialist on the transport of air pollution, including fine particulate matter, ozone, and air toxics. Understanding how our region's topography traps such substances in river valleys clarifies why the steel, petrochemical, and other heavy industries that have defined this area and should not define our vision for the future. Graham holds a Ph.D. in atmospheric science from the Massachusetts Institute of Technology and A.B. in chemistry from Harvard University. And now I will share my screen and go right into the presentation from John Graham. It runs about 20 minutes, and then we will be presenting about 13 minutes of Johnny Perryman. Please stick around for that. And we'll see you after this presentation.
Thank you for the opportunity to talk to you today about air quality in Pittsburgh. I'm looking at the past 20 years and reflecting on where we are currently and where we hopefully need to be and will be in the future. So this first slide is a summary of the air quality in Allegheny County over the last 20 years. And the data are presented through the air quality index lens that EPA uses to communicate about the severity of air pollution in any region where they monitor air quality. The air quality index is based on air quality standards, and each pollutant that is measured has its own standard and is put on the scale that's shown below for AQI category. If it's green or good, the air quality is generally well below the standard and not generally harmful to breathe. If it's in the moderate category, which is yellow, then those levels of air pollution can approach the level of the standard, and it can be harmful to breathe levels of air pollution in that range. Once you get to an orange, red, or purple, those are unhealthy for generally everyone and of varying severities. And so we really want to avoid any day with air pollution that's above the standard, and even would like to have it all the way down in the green, good area, because that's where the least harm is present for breathing air pollution. So you can see for this 20-year period that the air pollution back in the first decade of the 2000s was quite bad in Allegheny County. In fact, in the first block of years there, only 20% of the time did we have a day that was in the green, which is quite low. That's 1 of every 5 days had air pollution levels that were low. And then we had even more days, actually more than 20%, was a day that had air pollution above a standard for one of the pollutants. And that's the pollutants we're looking at here are fine particles, ozone, sulfur dioxide, and nitrogen dioxide. So that's a pretty bad place to be in when your pollution levels are exceeding the air quality standards more days than it's far below the standards. And that's where we were in the first decade of this century. The second decade is a fair amount better, but it's still not perfect. You can see that there are a lot more green days. Averaging over the last 5 years, we're in a situation where just under half the days are green, just under half the days are yellow, and we still have a handful of days that are in the orange or red range, which are problematic. And really, ideally, we need to get all those orange days gone and most of the yellow days gone, preferably all of them gone. One thing that we'll talk about is that this is just based on the current levels of the standard, and they may not actually be set at levels that are perfectly safe. And we'll talk a little bit about that with respect to fine particles. So this slide here is a summary of the previous slide, looking at the last 10 years, 2011 to 2020. And this is more reflective of current conditions. So it's a little bit better than the worst of the first decade. And what I've done is to break out the sites where the air pollution is being monitored and the type of pollutant that's being measured at each site, and showing which day was worst in that 10-year period. And what I'm showing is that it's not just one pollutant that ends up being the worst pollutant on any specific day, nor is it just one site. We really have a situation where there is bad pollution days across the county and for various different pollutants. The worst pollutant is PM 2.5, and you can see here that over 1,000 days, almost 1,200 days, were measured with the worst pollutant being PM 2.5 at the Liberty site. And that's probably not a surprise to most people that follow air pollution in Allegheny County. That is the location where we see some of the most severe pollution. We also have almost 200 days of SO2 that is the worst pollutant at Liberty. And so you can see that almost 2 out of 5 days, the worst pollution is measured at the Liberty site. But it's not the only place. If we look at South Fayette, you can see that ozone occurs was the worst pollutant at that location over 600 days over this 10-year period. And it was another 300 days. Ozone was the worst pollutant for the county. And so you can see that the South Fayette site is in one direction from downtown, and then the Harrison site is sort of in the northwestern direction. So really, we can have these high levels of pollutant occurring in many different places. And even if you look at the PM levels, there were high levels at the Avalon site, high levels at North Braddock, a lot of high levels in Lawrenceville, which is downtown, even Parkway East. So the point here is that we don't have one place that is always the worst place, and it's not just one pollutant. There's really a lot of things that we need to be concerned about when we're talking about air pollution in Allegheny County, even recent air pollution. This slide is zeroing in on the PM 2.5 in Allegheny County. In my mind, PM 2.5 is the worst of the pollutants from a health standpoint. I've plotted here 20 years worth of data for 3 of the locations where the measurements have happened over this whole span of time. The Liberty site, which is the top line, you can see that the pollution level is on the left hand on the y-axis, and time is on the x-axis. The Liberty site is the upper line. The South Fayette site, the green line, is the lower line, and the Lawrenceville site is in the middle. That's the blue line. And this essentially spans the range of pollution, annual PM 2.5, that's in Allegheny County over this whole period. You can see that Liberty has been the worst site the whole time. South Fayette is the best site. Now, there are other locations where there were periodic measurements that might have been, on any specific, few days higher or lower, but this is really pretty accurately spans what the range of PM has been across the county over time. And you can see that much like that first chart of the colors with the AQI scale, you can see how it's much worse in the first decade than it is in the second decade. You also see that there is a big drop that happened from 2000 to 2011 or 12, and then it sort of slowed down and even stopped, and we have a little bit of increase in the PM in the 2013 to 2017 period for the Liberty site. So that's important to see that we have decreasing levels and then leveling out. And part of that is by design. As I'll show in some maps following this figure, the mechanism that air pollution control happens in this country is such that it's these air quality standards, the National Ambient Air Quality Standards, the NAAQS, that drive how we change and improve our air pollution levels in the country. Really, without those, I don't know that we would ever make any adjustments to improve the air. But they seem to be effective at doing what they're meant to do, though maybe not as quickly as some of us might like. But you can see I've plotted on this figure the air quality standards. And back in 1997, EPA established a standard for PM 2.5 that didn't exist before then. It was PM 10 before then. And at that point, they established a standard that's 15 micrograms per cubic meter for an annual average, and 65 micrograms per cubic meter for a daily standard. And you can see that initially, both the Lawrenceville and the Liberty sites exceeded that standard when this period started. And EPA periodically reconsiders the standard, and they, back in 2006, evaluated new evidence that came into the fold from the health community, and they decided that they would retain that 15, so that black line stays constant, but they revised the daily standard to 35, so it went from 65 to 35. At the same time that EPA was making that decision, the World Health Organization came out with their own recommendations, and they established an annual standard of 10, which is the dark blue line that's below the black line. And also they established a daily standard of 25. So that's still below the 35 standard that EPA revised things to in 2006. And also in this time frame, Canada came up with a daily standard of 30, which is halfway in between the US standard and the World Health Organization standard. And so you can see that as these standards help set the bar for where locations are trying to meet and devising programs to have air pollution levels that meet these standards. And you can see that that's what happened. And we've got that downward trend. Liberty met its, or got close to meeting that 15 standard just in time for EPA to revisit the standard in 2012 when they changed the annual standard to 12. So you can see that that's where we're at right now for the annual standard in the US. But what happened shortly after that was Canada decided that they would establish an annual standard, and they chose 10, which was consistent with the World Health Organization. And they revised that yet again for 2020 down to 8.8. So you can see that over time, as we learn more and different agencies come to different conclusions about what the health literature tells us is protective of health. EPA had another opportunity to revise their standard back in 2020, and the staff, the science staff at EPA recommended that the standard be changed in a range between 8 to 10, and that's in the bracketed bar on the far right, which is consistent with the World Health Organization and Canada. And the administrator of EPA decided that it wasn't the right time to change the standard. Biden administration now is revisiting that, and it's likely we'll get a standard that is lower still. You will see that in 2018 to 2020, that's the first time that Allegheny County has met the 12 standard, which, you know, if things happen as we think they will happen, that will no longer be the standard in a few years, and Allegheny County will continue to need to reduce its pollution. So finally, I want to give a sense of how Allegheny County looks compared to the rest of the country, because I think it's important not only to understand how the air pollution is compared to what the government thinks the standards should be and what is a protective level of pollution, but also how we look relative to the rest of the country, because that's also a motivating factor when we think about where we want to be. We don't want to be the most polluted place. We'd like to be have the best air quality. And so this chart has a lot of data in it. This is starting again back at 2000. It's looking at a 3-year average. And there's a scale in the upper right-hand corner, which goes from the red dots are over the standard of 12. We have yellow and orange dots, which are over the World Health Organization standard. We have a sort of a light green or teal color, which is the 8 to 10 range, which EPA has recommended last year for being what they think the standard should be. And then we've got a darker bluish color, which is below 8, which is generally expected to be the most protective level and the best, where we should all be shooting for. In the lower right-hand corner of this is a relief of the Pittsburgh area. So you can see that this has monitors for Pittsburgh and for Beaver County, Washington County, and Westmoreland County. So what is plotted here on this map are the county maximum values across the country. And there are roughly 800 monitors that are here, even though there are over 3,000 counties. So just understand that there are a lot of places in the country that don't monitor for air pollution. Generally speaking, we expect the levels of air pollution to be lower in those counties than not, but the requirements are such that you only have to measure where you think there's going to be an exceedance of the standard or where there are an appreciable number of people. And so in the Western US, there's a lot of open space, so we don't monitor in many of those locations. And then finally, in this figure, the lower left-hand corner is a histogram, and that's just the summary of all the monitors in the country. And you can see based on that, you know, that red bar, it says 61% of the monitors in the country failed to meet the standard of 12 back in 2000 to 2002. And Pittsburgh is one of those places. So if we step through and moving in time, you can see moving to 2006, 2008, some of the country is starting to change. We're moving, some of the red dots are getting cleaner. And then you step another year to 2007 to 2009, and it's getting better still. But all 4 locations around Pittsburgh, including Allegheny County, those counties all exceed the standard. When we get to 2010 to 2012, at this point, the air quality has improved across most of the country. The Clean Air Act has done its job. States have been reducing their emissions. You can see that there's an isolated set of monitors along the Ohio River Valley and sort of in Cleveland and Allegheny County and Pittsburgh, a little bit in Philadelphia and New York. So there's really a lot fewer. If you look down in the left hand at the histogram, only 10% of the monitors exceed the standard. We went from 60% down to 10%. So that's quite a drastic change over 10 years. Continuing on, if we look at 2013 to 2050, by this point, really it's California, the Central Valley of California has a lot of the monitors left that exceed the standard. And then you've got you've got this Pittsburgh monitor, and then you've got one in Cleveland. So by this point, you have almost all the country meeting the standard. And then you've got, Pittsburgh doesn't meet the standard. And even these locations that are near Pittsburgh are not too far underneath the standard. So it's still sort of the bullseye of poor air quality in this whole region. It's not just Allegheny County, but Allegheny County is the worst, at least in the eastern US. And then if we go one more step forward to 2016 and 2018, this is the last graphic that I have. These data, you can see that it's just Pittsburgh. It's the lone county in the eastern US that continues to exceed the standard. And you can see that by this point, there are only 4% of 19 counties in the country that exceed the standard. Most of them are here in California. And then you've got the lonely county of Allegheny here in the east. So again, it's important to see that there was still, the year before that, a few years before that, there was still this bullseye of poor air quality in this whole region, with Pittsburgh being the center and worst of it. And so when people argue that it's just one monitor and it's really the rest of the air pollution in the region is just fine, I mean, if you're comparing that to the rest of the country, you can see all these other dots are in the blues and greenish colors, which are much less polluted than what we've got right here. So that's what we're really hoping for. We want everyone to be in this much lower pollution level. And that's our goal. That's where we're headed. I do want to say that looking at those standards, if we were to revise the standard for the nation to match what the standard is in Canada, some folks will look at the improvement that we had and look at the most recent years, the 2000 to 18 and 20, how most of the days they're either green or yellow. We're almost all, we're really making progress. If we were to have Canada's standards instead of the current US standards, instead of having half the days be green, we'd only have a quarter of the days be green. Instead of almost half the days being yellow, we'd have 2/3 of the days being yellow. Instead of having, only a handful, maybe 10 days in the year that exceed the standard, we'd have 3 times that. So a month of the year would have days where the standard is exceeded. And that's if we meet, the metric that Canada says is appropriate. And Canada is making the same evaluation of the same data sets, the same health studies that the US does. It's just that they've decided to set the standard in a different place. So if we really achieve those standards, there'll be we have a lot further to go than what you might think just by looking at the US air quality standards. So in summary, we've made a lot of progress. Allegheny County is doing well compared to where it was, but that's really not where we want to be. And even the air quality standards that we have are not necessarily sufficient to protect our health. And I haven't talked about this, but the daily standard for PM is actually, it's called the 98th percentile standard, the form of it, which means that you can exceed the levels of healthy, quote unquote, healthy air pollution on 8 days a year and still meet the standard. And the ozone standard is similar. That allows you to exceed the standard 4 times a year and still, in theory, meet the level that the government thinks is protective of health. So it's not truly protective, it's just, but it helps push us in the right direction. And it's true that Allegheny County, but based on the most recent data, does meet the current level of the PM standards and the ozone standard, but it doesn't meet the SO2 standard. And it's likely that at least the PM standard will be revised in the next couple of years, and it's possible the ozone standard will be revised as well. And it may mean that the levels of those pollutants exceed the national standard again. In any case, we need to reduce all those pollutants to really be protective of health for people in the region. And other big points, it's not just one location. It really is a regional problem. Different pollutants are problematic on different days in different places. So we have to think about this in a holistic sense to really understand what the nature of the air pollution problem is in the county. And that's a wrap. Thank you. And if anyone has questions, I'm happy to take them by email, or you can email me at jgraham@catf.us. And we can be sure to provide that data just in case folks need more information or have questions. I'm happy to entertain those when you have them.
Super. Thank you so much, Dr. Graham, for that very informative presentation. As always, I love to see when he has a new slide to share. And now, with no further ado, I'd like to just move straight to our final presentation, our testimonial by Johnny Perryman that I recorded just last weekend at his home in Clairton, Pennsylvania. Johnny Perryman is a resident of Clairton, PA. He's a retired contract negotiator for the Teamsters Union and moved from Seattle, Washington to Clairton about 14 years ago. And he lives about a mile from US Steel's Clairton Coke Works, our worst source of air pollution. A decision to move near a friend in the community with a low cost of housing has had its health consequences. Perryman has been featured in numerous newspaper articles. I know that he also has a book that he is selling on Amazon as well. And now for Johnny Perryman.
Well, my name is Johnny Frank Perryman, and I spent most of my life growing up in Seattle, Washington. House prices was going crazy in Seattle, and everything was, the price of everything was going crazy. And so while I knew the house, that crash was coming, and so I dumped my house in 2007 because I knew that house crash was coming. And I took the money and I moved here to Clairton because the houses were cheap. And I bought this house that I'm living in because I had so much stuff. I needed a place big enough to put all of it in there. And I thought this would be the last place I would live. But I found my health starting to go down, after I got to Clairton. Now, to move everything I had to here, to this house, even any young man would be a difficult job making a move like that. See, I did that in 2007, when I was in my 60s. And I moved here to Clairton. And I liked the people I met here. I just thought, they were so friendly, and I got housewarming gifts when I got here. But I found that my health, I couldn't do as much as I could before. And some days I would really get weak, and I didn't understand what it was. And I thought it was just, I had a pacemaker and a defibrillator anyway, and I thought it was just that, what I had. I found out later that when I would really get weak is when the air was bad in Clairton. On the days when the air was really bad, I used to come in here and run upstairs to the bathroom, but then I would come in on a bad air day and go to run, and no, you ain't running. I wind up crawling on stairs and getting up to the top. As soon as I get up to the top, I go into the first bedroom and lay down, because by the time I get up to the stairs, I don't have to pee anymore, and I'm too tired to go to the bathroom. I had to lay down until I got the energy to go to the bathroom. And this was what the pollution was doing to me. It limited my leaving the house. Below 50, the AQI, the quality of the air is supposed to be good. And there was a time when that air was good. And then if it's above 50, for people with my underlying conditions, well, then I should not exert myself outside of, in the outside air. And then when it's above the 100, then it's really dangerous. And nobody should be exerting themselves on the outside air. And then when it's above 150, it's almost time to evacuate the city. When I came here to Clairton, especially when they had that fire that Christmas Eve in 2018, and they let the pollution level go up to astronomical levels, and they were killing us here in Clariton. Now they have all kinds of data that tells you what each of those pollutants does. And it tells you about what it does to the heart. It tells you about it causes cancer. It tells you about how it causes asthma and breathing problems. It tells you about how you die early from that. They have all this data, okay? And I went down to a hearing down at the health department, and at that hearing, I testified. In a couple of months, I'll be 76 years old. My heart works at about 73% of capacity, and I don't mind smell, but I have a good feeling that what we're doing here is going to kill me. And they talk about getting it done by sometime in May. And sometimes I go into my house, I don't know if I'll be alive tomorrow. And it's wonderful that the county is finding the culprits for all the things that they're doing wrong, and they're taking that money and building new offices with it. But I think that if they took that money and bought people gas masks or show you a map where the quickest way out of town to some fresh air, or put some kind of breathing air cleaners in your house, or even tell you where to buy them or what to buy, that would do me a lot more benefit than building another office. I live in Clariton. My house is 8-bedroom house. It's like a museum. I have a hand-carved square grand piano that was on display at the Crystal Palace in 1860. I got Haile Selassie's wife's necklace. I got oil paintings all over the place. And I'm thinking about walking out the door and moving the hell away from here and forgetting everything and leaving everything. And so when I walk upstairs, sometimes just getting to my bed, it feels like I've done walked across a desert without water. And if I can get on that bed, then I can rest for a minute. You don't have to tell me when the air is bad. When the air is bad, I put the mask on my face. I have more masks than this. And then I start feeling better after a while. I thought I would be able to come down here without the mask today, but I got just about here in Pittsburgh and I had to put it back on.
Please finish up.
So I just would like to see you do something. If Clariton is Coke Works is not going to do anything for us, I would like some kind of indications other than stay in your house, what I can do for myself.
Thank you. Our next speaker is Gloria Ford about Clariton.
Let me just say, if I'm dead in a couple of months, there's nobody going to file any charges for murder for anybody down there at the Coke Works. And I was thinking that they're killing people here in Clariton, and they don't even know the people that they're killing. They don't know me. They don't know what I contribute to humanity. They don't know. I'm developing backwards now because I'm in Clariton. I talked about running up the stairs and down the stairs. Right now, I have a chair that I got to sit in and push a button to ride up the stairs and to come back down the stairs. The hardest part of me going shopping to a grocery store is walking out the house to my car and getting in my car. And then I have to rest for a while after I get in there. And then I can drive to a grocery store as long as it's not too far, and I can get in one of their riding cars to go around and buy everything and then drive back. Putting the groceries in the car is difficult. And then I drive home, and once I get here, I have to get the groceries from the garage into the house, okay? Now, I've reached a point where I use Instacart or whatever that is, where I just get on the internet and order groceries from the store, and they bring it and they set it on my porch. Now, even that, going out to my porch, picking up the groceries and bringing it into the house, that is a chore for me. I got to take a few things at a time and put them on my walker, which have wheels on them, and then I have to wheel them into the kitchen and take them off and put them wherever they want to go, sit down, rest for a while, go get a few more things. Now, they say that below 50, the air is good. It shows green on the internet. That's good air, below 50 AQI. Now, after you've been breathing, like everything that I was breathing in when they had the coke fires, your lungs, your body, there's not as strong as it used to be. See, and it don't take as much to slow you down and to stop you. So if the AQI go above 35, hey, I need to watch out what I'm gonna do. I need to relax, I need to take it easy. I can't even function well in the part that's supposed to be good. Now, in March of 2019, my doctor told me, pack up and move out of Clariton. I would get out of Clariton. Don't even stay here. It's dangerous for you. That's what my doctor told me. Okay? Now, when he told me that was after I was breathing all that stuff from the coke works. Now, it was hard for me to move in my 60s when I moved here from Seattle. I'm in my 70s now, and I have been drugged by the coke works. How am I supposed to be able to do that? We need to do something about the quality of life that we have here in Clariton. I was running around from one organization to the other until I got tired, you know. And I had an ulcer, a bleeding ulcer. I had to go to the hospital the first of this year. And when I came back, I decided that I wasn't going to do all this running around anymore. And so I decided I was going to use the God inside of me to get rid of this pollution. And so I made a decision to do that. And then a few days later, United States Steel announced that they were shutting down, hot idling some of these old ovens down here at the coke works. And so I'm still working with the God inside of me to see what can be accomplished. I would like for the health department to use some sort of influence to get the city to put in air purifiers with the money that you send here. And I would like for you to come out and talk to the people that receive the air purifiers and see what they think about it and how they feel about it. And you said for the people of Clariton to make a decision on what to be done with that money. And they should get together and have a committee to determine that. And I tried to figure out ways to get people on that committee. And the mayor decided it was going to be him and somebody from the city council. And I guess he don't care who the people decide should be on that committee. And so our needs are not being met. The overwhelming majority of the people that ask for anything asked for air purifiers, and we did not get them. So if there's something that the county can do, you know, I mean, if the county just send me the air purifiers, I'll make sure somebody get them. If they send me the money for the air purifiers, I'll make sure they're bought and used for that. I don't have the strength, but I have the will to make sure it got done. But I would like to see the people here in Clariton breathing better and treated better. I'm afraid to grow vegetables in my yard because I don't know what pollution is going to be on top of them. So whatever you can do, I would appreciate it. And thank you very much.
So just want to extend heartfelt thanks for Mr. Perryman for sharing his candid reflections on a very challenging situation that he's encountered. And he speaks so powerfully and so directly about it. And he just invited me into his home for hours and hours and showed me so much of his beautiful home. And I wish I could show some of the art. That's a whole nother project to be able to showcase the art that he has in his home, but it's really magnificent, covering virtually all the walls. Much of it from Africa, and it's absolutely stunning. So a real inspiration. And his comment really hit home about how that, they don't know who they're killing and the contribution that they're making to that community when we lose people prematurely to air pollution. So it's just something else. So now we have time for open mic. This is where, and I know this event has gone long. I thank everybody who stuck on so long, which is most of the people have stuck with this whole time. Thank you, can't thank you enough. And I will now turn over the mic, the proverbial mic, to Howard Rieger to facilitate the open mic time. And we'll just go as long as we need to, unless we run into a hard stop, but we'll just see how we go here. Thanks, Howard, and go for it.
Thank you. Well, the ball's in the community's court. We got a good number of people on, and I'm not going to say anything about what we just heard other than thank you to the presenters. Powerful information, some powerful testimonies, and we do have plans for what comes next from our standpoint, but let's hear from you.
If there's somebody who would like to say something, you can raise your hand. We can put the spotlight on you. Just know that we're recording and we're live streaming out to Facebook in real time.
Anybody? I will just make one simple comment. There's things. Okay, we do have a hand up. So Megan.
Hi, how are you all today? My name is Megan McDonough. I am the Pennsylvania Director for Food and Water Watch. I am also a lifelong Allegheny County resident. I myself, my children, generations of my family have lived with the poor air quality here in Allegheny County for quite some time. And I just want to come here today and first off, thank everyone here for giving their stories and all of the very helpful information by health professionals here for residents of Allegheny County. The other item that I would like to bring up that sort of goes along with Mr. Perryman's testimony and his story is the overarching message here, at least for myself and others that I've worked with on the ground, is that the Allegheny County Health Department has failed to protect the people of Allegheny County time and time again. This is something that has gone on for far too long. And not only are we dealing with the current pollution that is on the ground by these companies, in fact, they are looking at permitting even more with another major source polluter in the Montauk region, which we are currently trying to fight. One of the things that have come up time and time again with this lack of regulatory action, lack of actual enforcement of the laws that are already on the books. So Food and Water Watch has partnered with Protect Elizabeth Township in our effort. We would like to call on, we are currently requesting an investigation by Attorney General Josh Shapiro into the Allegheny County Health Department's regulatory failings that have left countless residents vulnerable and exposed to these environmental violations and illegal pollution. And obviously we would love to have the support of those on this call today. I can also continue to drop into the chat our organizational sign-on and individual sign-on, but it's going to take all of us to help make a difference here and to help stop this. And I thank you all for putting this together and giving me a moment to speak. Thank you.
Thank you. Anybody else?
Vincent, Vincent has his hand up. Please, Vincent, go ahead. Oh, where'd he go?
He's on mute.
We'll get you there.
I heard recently that the Clerk Coke Works is shutting something down at their facility. Is that only part of the facility?
The plan is only part of the facility. It's 3 of the oldest batteries where they process coke, where they cook it. I think the schedule has been extended. I don't remember exactly when the new deadline is. Maybe Matt McNally, somebody on the call does. And it's uncertain what the impact will be. One of the problems, one of the challenges with Clairton has always been the way it works in Allegheny County is that when there's a particularly bad day, we, the residents, get notification about don't go out with your lawnmower, your weed whacker, or don't fill up your car during the day. There's no requirement that industries that are the largest polluters do anything to back off from production. So it's a problem, for a virtually 120-year-old plant. But yeah, there was a plan announced that it materializes to close 3 of those batteries. So Larry Sims had his hand, and then Shaman. Larry.
Thank you, Howard. I have a question for Mr. Graham. I don't know if he's still on or not.
No, he was there by video.
Okay.
Well, we can relay a question to him if you'd like.
Sure.
You can also...
maybe someone else can address this. As I was looking at his graphs of our track record over the last 20 years or so, I thought, gee, the problem is still substantial and the standards are probably not stringent enough, but there's been great progress and it left me feeling a little bit optimistic. And at the same time, I was monitoring the chat box with, there are some very compelling arguments made by JPC, whom I don't know, but if his, and I have no knowledge on the subject, but if his comments about where the monitors are located are accurate, and I have no reason to doubt them, then I don't know how relevant the graphs we've been looking at are. It seems to me like the curves that have been tracked for Liberty and South Fayette and all these other locations should be pushed considerably higher up on the chart because of the, let's say, questionable location of some or all of these air quality monitors. And I'd like to understand that. If we're measuring pollution at an altitude of 1,000 feet and the point sources are at 600 feet, then we're not getting reliable data. And that would skew all this information. And who do we even talk to about that? Who determines whether the EPA designated locations and protocols for measuring and reporting this critical data is something we can rely on or not? That's
Albert. Yeah, Albert, I feel like is the right guy for that. Howard, would you agree?
Yeah, Albert.
Go ahead, Albert, please. You're the guy.
So yeah, just a couple comments. So I put some of this in the chat. The EPA has like this giant guidebook for how to cite, where and how to cite monitors. And in my dealings with the health department, they are a very by the book sort of organization. So they are most likely following those, what EPA said to the letter. So that's one piece of it. you know, a lot of what we've done, I think we started all of this sort of mapping work thinking we would find a bunch of like these hidden hotspots. And we really necessarily haven't when it comes to industrial emitters. We've seen them with like small sources or neighborhood scale sources, or, you know, something in one particular neighborhood that people didn't realize was a big source, but that is. But like the big industrial sources, we have not necessarily found sort of these unexpected hotspots. I mean, there's a monitor in Glassport, there's one in Liberty, there's one at North Braddock. Those seem, the North Braddock and the Liberty, from both like our measurements and what the county does and some modeling that we in the county have done, seem to be the worst spots. You know, and so I mean, and then there's also like the data quality that they have to report, the sort of standards they have to meet for data quality are sort of through the roof. So I see no reason to not trust the data. And, you know, I don't work for the health department. I am not like, I know people there. I'm not necessarily like friendly with anyone there. None of my family works there or anything like that. I don't have any conflicts of interest with that regard, you know, but, you know, there's comments in the chat that are on the borderline of, you know, sort of personally impugning people at the health department. And my experience with them is like, they're doing the best that they can. They have a pretty limited budget, you know, they're doing the best that they can with what they have. And maybe they are not as transparent as people would like at all times. And I think that's a valid criticism, but like, I don't know. I think it should, you know, I think if people feel like the health department could do more, there's a way to express that isn't sort of personally attacking the folks at the health department.
I'd like to comment. My name is Jonathan Everly, and I don't have a Ph.D., and I'm not on faculty at a local university or anything like that. So you're going to have to take the value of my opinion at face value. But this morning, when I drove across the Great Bridge to Homestead on my way to work, I could see very clearly thick pollution looking eastward in the Mon Valley towards the Braddock-Clairton area. And when I looked west towards the downtown south side Hazelwood direction, it's clear. I wear a respirator and I would follow the purple air monitor data on a regular basis. And I respectfully have disagree with many of the comments that were just said. The Allegheny County Health Department, if the best they can do is to not meet EPA federal air quality regulations for every year since the enactment of the Clean Air Act, except for the year during the pandemic when basically all the traffic and industry was shut down, that's not good enough. If the best that they can is not good enough, and they're the only people that are responsible for protecting the health of the citizens of Allegheny County, then if maybe they are doing as good a job as they can. So we just need a new health department that actually gets the job done, is what I'm saying. They've actually failed to meet national air quality standards and protect citizens' health for every consecutive year. And it's looking like it's going to be this year as well. Furthermore, I put a link in Google Docs. There is no, I looked at the air quality monitoring network plan, and I'm saying that the Liberty monitor is 700 feet above, or the Clairton Works is 700 feet above sea level, but the monitor is at 1040 feet above sea level. And I want to put that into perspective. The US, that's a 500-foot physical barrier if you consider that the hillside that is between the monitor and the plant is at 1,260 feet. So all of you can look up the air monitoring network plan. You can look at the GPS coordinates of the monitor. You can look at the point source for the pollution. And you can see on, if you go to mon.createlab.org, you can see on a given morning through the CMU Create Labs webcams, you can see the pollution haze sitting at a altitude that does not go higher than the hillside behind it. Even Jim Kelly, who works for the health department, has been quoted on camera in an interview with WPXI in recent years as stating that during inversions, the pollution clings to the altitude of the river valley.
Yeah, JPC, I hear you. You make compelling points, so did Albert. But time is the essence, and I wanted to get to Shaman, who's actually put up his hand before you did. And we'll get back
That's
to
fine. All I'm saying is that the monitor data is not accurate if it's not in the path of the highest concentration of pollution coming from a known point source emitter. We know the point source emitter and we know the location. I want to just close by saying,
just in the interest of other people that are waiting and actually were in line before you. So, I mean, send me an email. I'll post my email address in the chat. We'll continue that conversation and I'll share it with the group.
I'm just not down for misinformation.
Is Shaman still on the line? He may have given up. So Melanie?
I appreciate all that you bring, JP, because I think that living in Clairton, we have so many people misinformed and they fail to take action. So we have a large number of mothers with asthma here. We have a large number of children of deceased parents. Their parents may have died of cancer or autoimmune that have been linked to the air pollution. So it is vital that we get that at least supports our public health. It is interesting to me that people fail to mention that the mayor that works for the industry is silent about the air pollution. I don't think that would go on in a predominantly white community. I don't think that a predominantly white group of people would accept a mayor allowing harm to health without saying anything. We have a number of churches, we have a number of leaders, and when you look at the data, you see a number of nonprofit organizations. How can you be a nonprofit organization set for policy for Black people and fail to acknowledge environmental injustice? This environmental injustice is linked to gun violence, mental health issues, death, early death, so premature death in infants. All of it is linked. And when we don't have a group of people in the Mon Valley coming together to bring it all together as one, then we individually suffer alone in silence because we don't have leaders looking out for our best interests. And for me, I've heard it mentioned as sacrifice zones, but we are willingly sacrificing ourselves instead of giving voice and empowering our youth to speak up for our elders. And that's why I think this town hall was great. It brought it all together. And I'm just hoping that we will soon see those in the Mon Valley coming together. Take Action Mon Valley, Valley for Clean Air Now, whatever we have going on in Elizabeth, Floref. All of these organizations should combine to create what you've created here so that our voices are maximized and we can see the power and share the experience and empathy and realize that together we can change if we come together, when we come together, and it's now. Thank you, JP.
Yeah, I just want to kind of bridge the maybe it's the gap between what Albert said and what JPC said. And, the reality is, however you want to view the Allegheny County Health Department, and believe me, I've attended some of their public hearings and I've been cut off when I wanted to speak. And, maybe they are doing the best they can. They do have limited resources. It begs the question, why do they have limited resources? Where's the will of our political leadership, our county executive, to give them more resources so they can do a better job? But it also begs another question, is the Allegheny County Health Department didn't make a decision to allow the Shell cracker plant, the plastics plant, to show up in Beaver County to pollute our region again with a different kind of problem, petrochemical industry. We have the steel industry clearly on the downhill slide. U.S. Steel is a shadow of what it was. So where's our vision for the future? The vision for the future isn't developed by the Allegheny County Health Department. It's developed by our county executive and the county council. It's developed by the political leadership of the city. It's developed by the corporate leadership that I said at the outside. It's been sitting on the sidelines silent. And where's the voice of healthcare, et cetera, so that if you really want to focus on this, I think, and focus on what Melanie said, bring us together, amplify our voices. We need those other forces on the ground talking about the need, making the case for what needs to be our future, creating a vision that's different than what we created 100 years ago, just by happenstance, because we had the coal supply and we had the labor force, and there it was, and nobody was focused on the downside. So I think there's plenty to be done here. And we need to raise our voices and make some decisions about where we can put the greatest pressure. So any other comments? Anything else that you see, Mark?
I don't see any other hands raised. Melanie's hand is still raised. Is that a fresh hand, Melanie, or is that a no? Okay. Great.
What we will do is we will record, obviously the program's recorded. We will make a copy of the chat. We will go through and look at the individual questions that were raised. So that
Shaman is back.
I'm sorry?
Shaman is back.
Oh, Shaman's back. Okay, Shaman.
Greetings, everyone. Greetings. I do appreciate this opportunity to speak on these disparities.
We could hear you.
Yeah, Shaman, it's difficult to hear you. Please speak up. And if you have video available, that'd be great. Otherwise, we'll just, great. There you are.
Okay,
Wonderful.
you can see me. Let me make the light more clear. Thank you, everyone.
Yeah, just please speak loudly into the mic.
I hope I pronounced your name correctly.
You did a perfect job. Thank you so much. Much appreciation. So I'm glad that this forum was put together. So I am Shaman Pomaichak Mom Yahalahi of the Iroquois Confederacy of Aborigine American People, and excluding Indians not taxed. And I want to say that a lot of times in the research that has been done on communities that are identified as Black and Brown communities or people of color, there is a percentage of people that are not taken in consideration, that are mixed in within these peoples. And these are the people who would be identifying themselves as the Aborigine people, as the original, the Onkwe, the original people of the Americas. And we're going to focus specifically on these lands. So in those communities where there are these disparities, and there are these illegal dumping sites, and we've done our own research and due diligence around the nation, and it permeates in those communities. And this has all been spoken. So I just want to add that it is very important that when one is doing statistics, take into consideration that there has been ill-conceived policies and depredations that have affected people that are identifying now as Black and African-American, and even maybe possibly people of color. So the history kind of avoids and kind of pushes out the fact that there was a forced assimilation of our people, who are the Aborigine people on these lands, right? Who are adversely affected by all of these conditions. And that these people who identify themselves as Indian in this particular time period were reclassified as colored. And that was a part of the Racial Integrity Act that was created by Walter Ashby Plecker. And this is the United States of America's hidden secret that is now being challenged in the courts and being challenged in the educational system. And we are the ones that have to do this. So many of the people that in your study that you've identified as Black people or identified as African-American people are truly the Aborigine people, the indigenous people of these lands. And these conversations must be included in all of these demographics as they're being created to show what disparity looks like. We are being silenced because of a forced assimilation that a lot of our ancestors did not choose to be reclassified and relabeled as Black, or relabeled as Negro, or even relabeled as African-American as early as 1989. So I want to be very, very clear that a lot of those numbers that are just stating they are quote unquote Black people or quote unquote African-American people are truly Aborigine people and truly indigenous people. And we have been speaking to City Council here. We've been very, very vocal, and we do stand in support and solidarity for all the people who are affected by the poisoning of our waters and the poisoning of our soils and the poisonings of our air. We have always been a peaceful people. If you look in research history of when Europeans first arrived here, we were very kind and very courteous and very helpful. And when the 13 colonies were established, the penal colonies, which is what they were actually initially, we were even very open and helpful in helping those people too as well. So we want to be clear, and we want to make sure that our voice is interjected into these narratives. I'm willing to leave my information here in the chat for people to reach out. We would like to, and I specifically as the medicine woman for our people, as the healer for our people, and the shaman for our people, I'm very, very concerned that our voices are included, because our children are mixed in with these numbers and they're invisible. And that's a problem. And so we've met with the mayor recently. We'll be sitting on some commissions and things of that nature. And so we're taking a position that's a bit different than what's here. And I'm grateful to everybody who's done all this great work and helping to bring this awareness and hold these people accountable. Our position is a little bit different. We're the owners of these lands. We're the stewards of these lands. We never ceded land, and those are misconceptions. So we, of course, want our lands to be free of contaminants and chemicals in the air and poisoned water and contaminated soil. So we come from a different approach. We come from an approach of the actual stewards of the land, and it's important. So I stand with you in solidarity, and as we continue to force the hands of government to do what is right by the indigenous, the Aborigine people on these lands, everybody else will also benefit. And that is without question, because they have a debt to us that is owed to us. And there are many of nation states throughout the South and throughout this territory here. We call it the Delaware Territory. That's what we call this territory many, many years ago, which included New York, New Jersey, as well as Pennsylvania, Ohio, and parts of Virginia. So stand in solidarity with everybody that's here. I'm also on another meeting with the USDA Agriculture dealing with, so I'm doing 2 Zooms at the same time. I'm just glad I got an opportunity to speak. I know some of the people that are in the chat. So Alito, Osio, and Nleke, Alakain in our language, the light in me honors the light in you all, and I yield. Thank you so much for my time to share that piece of information. And hopefully we'll get allies that will help us push the hand of government to do what the people need to have done, to remove the contaminants, to clean up the air, to create more green, efficient ways of doing things. And my ancestors have a lot of great and intuitive and ingenious methods that have not been utilized in maybe hundreds of years. And some of those things need to be put back in place, because we were actually able to steward our land without creating all this toxicity that we're experiencing today. I yield, and thank you, everybody.
Thank you, Shaman, and thank you, everybody. I really appreciate this portion of the meeting. And we go to a county health department, they give you 3 minutes to talk and cut you off after 2. I'm sorry, JPC, if you feel I cut you off, but I wanted to give everybody a chance to participate. And I know with the hour being late that we're losing people at this stage. So I thank everybody, and we're going to have a 4th town hall. It will be sometime in September. Check back with us. We'll be in touch with you. We now have your contact information. And thank you, Mark, and thanks to everybody in the grassroots steering committee who made this all possible.
Yep, thanks so much, everybody. Please stay in touch, stay in the loop, stay energized, and keep us informed about your reflections as they emerge. I want to thank our sponsors, sponsoring groups. And with that, I'm going to end the live stream on Facebook. But you can all watch the live stream on Facebook as soon as the event is over. There we go. And that's it for today. Thank you, everybody.
Thank you,
See you next time. Bye-bye.